Hello everyone. Today we will discuss about one of the important clinical examination topic, that is about liver cell failure signs. Liver cell failure signs. When we are taking a case of per abdomen, especially liver disease, that is cirrhosis case, in general physical examination, it is very important to mention about liver cell failure signs. So it is always easier to mention these signs from head to toe. So we will discuss in the same pattern today. First will be about the icterus in the eyes. So icterus is considered as a sign of liver cell failure. This is first one. And you know the mechanism also. Increased bilirubin because of parenchymal liver disease, or sometimes even due to some obstructive causes in liver disease itself, can lead to icterus. Then in the face, second sign will be parotid swelling. So parotid swelling. Here bilateral parotid enlargement will be seen, and this will be painless swelling. We have to remember this, painless, and it will be bilateral, and more precisely it will specify towards alcohol etiology. So mainly alcohol related. The thing is, alcohol intake and sometimes associated malnutrition in these individuals can lead to fibrofatty infiltration of the parotid gland. Can lead to fibrofatty infiltration, leading to parotid swelling. So this is the mechanism. So after icterus and parotid swelling, coming little bit down, we will be looking for some chest findings. For example, first one is loss of axillary hairs. Loss of axillary hair. Similarly, there will be loss of pubic hair. So which we will deal here only, pubic hair. So this is mainly because of the imbalance between the androgenic hormone, mainly estrogen, and free testosterone, which I will explain it soon. So this finding we will look for, which is considered as a sign of liver cell failure. Then in the chest itself, we will be looking for gynecomastia. Gynecomastia. So here there will be glandular enlargement. So there will be enlargement of glandular tissue just below the areola, leading to gynecomastia. Again here the reason will be related to imbalance between some hormones. Next liver cell failure sign in the chest will be breast atrophy. Breast atrophy in females. This is again more precise towards alcoholic etiology. Alcohol related mainly. Then one more liver cell failure sign in the chest, mainly in the territory of superior vena cava, will be spider nevi. Spider nevi. So what is the meaning of spider nevi? There will be a central arteriole with radiating vessels around it, and when we give some pressure, it will blanch. So it will be blanching, and the blood will refill from periphery to center. So because of this structure, that is central arteriole with sideward radiating vessels, it appears as a spider web. That's why the name spider nevi. So it is blanchable, and the blood will refill from periphery to center. Usually the size will be of a pinhead to 10 mm. So this one we have to remember. And the thing is, in some individuals, up to 5 spider nevi will be normally present in some individuals. So anything more than 5 should be considered as sign of liver cell failure, or if these are already present and now the size is increasing, then you can consider again liver cell failure sign or the presence of spider nevi. And the thing is, this will be restricted to the territory of superior vena cava. These are few things about spider nevi, and often the question related to spider nevi will be the differentials for spider nevi. So you can consider some hereditary telangiectasias. Even mosquito bite might sometimes appear like spider nevi. So to differentiate from these, just remember this will blanch and the blood refilling will be from periphery to center, and it will be restricted to superior vena cava territory. So these 4 things are present in the chest area. Then we will deal the further signs. Now the next sign, we finished till the level of chest. Then we can consider ascites as a sign of liver cell failure, which you already know, that is fluid accumulation in the peritoneal cavity. Then in the genitalia there will be testicular atrophy, which is again a sign of liver cell failure. Here, when to consider it as atrophied testes? Normally the size of testes will be 4 to 6 centimeter. If the size is 3 or less than 3, we can consider it as atrophied testes, and testes will be usually soft here and small. And the instrument which is used to measure the size of testes is Rader's orchidometry. Again, the reason will be hormonal imbalance. So we told that for multiple things, for example, gynecomastia, breast atrophy, even testicular atrophy, and similar thing when you consider in females, there will be ovarian atrophy, there will be menstrual irregularities, even infertility. These things we can see. So for all these things, the main reason is hormonal imbalance. So to understand that, mainly in liver cell failure, there will be imbalance between estrogen and free testosterone. So this is the major reason, because liver metabolizes multiple hormones normally. So when there is liver cell injury, this metabolism will get affected. This is one mechanism. Then in many cases, alcohol impairs these hormone balance. Even alcohol can affect pituitary directly, pituitary dysfunction. And in some cases, when the patient is already taking some medication, especially spironolactone, which we commonly prescribe in cirrhosis case, spironolactone, it has anti-androgenic effect. So these are the mechanisms which will lead to imbalance in estrogen and free testosterone. So we can consider there will be decreased free testosterone and the estrogen activity will be more. That's why we can see there will be loss of androgenic pattern of hair, testicular atrophy, even gynecomastia. And this increased levels of estrogen in liver cell failure will manifest with some other findings, which we will discuss now. So this is the mechanism. Coming to the next sign of liver cell failure. So we have to look for the extremities, that is arms and lower limbs. So in extremities, what are the liver cell failure signs? One is palmar erythema. So here, thenar and hypothenar eminences will appear red and they will be warm to touch, and when we give some slight pressure, it will blanch. Again, the color will be refilled. So that is nothing but palmar erythema. Again, the reason for this one will be increased estrogen levels. Then there will be Dupuytren's contracture. 10th one is Dupuytren's contracture. Here, flexion deformity of the fingers will occur because of the thickening and fibrosis of the palmar fascia. So the mechanism is palmar fascia thickening and fibrosis of palmar fascia. So when it is thickened and fibrosed, it will lead to flexion deformity of fingers. That is nothing but Dupuytren's contracture. And this thickening and fibrosis is mainly because of free radical injury due to alcohol intake. Alcohol intake. So we can consider again Dupuytren's contracture as a more specific sign of alcohol related liver injury. Then in the extremities itself, the next sign will be ecchymosis. We have to observe for ecchymosis and easy bruising and bruises. So as we know, this is mainly because of the synthetic function of liver abnormality, that is hypoprothrombin levels. Prothrombin. And one of the other reason is low platelets because of hypersplenism in liver disease, hypersplenism. So these are the two reasons for ecchymosis and easy bruising. And again in the extremities, always look for pedal edema. Pedal edema. So again one of the function of liver is to synthesize albumin. So when there is hypoalbuminemia, it will lead to pedal edema. So the mechanism here is hypoalbuminemia. So these things we will observe in the peripheries. Then and one more sign of liver cell failure is flapping tremors. Flapping tremors. So here we will ask the individual to outstretch the arms and hyperextend the wrist. So they have to hyperextend it. Then we will be able to observe there will be flexion and extension. Flexion, extension of the digits. So that is nothing but flapping tremors, which is also called as astraxis. Astraxis or negative myoclonus. Negative myoclonus. When there is liver injury, liver will detoxify many toxins. So when it is injured, toxins will accumulate in our body. So these toxins will interfere with the relay of some sensations from the joints. So there will be disturbance. There will be disturbance in relay of joint sense. Joint sense, leading to intermittent fall of the posture. Intermittent fall of the maintained posture. So this will lead to intermittent fall of a maintained posture. Maintained posture, which appears as a tremors. So this is the main mechanism. So mainly disturbance in relay of joint sense because of toxins. So this will be because of toxins. Same thing is observed in some other conditions. For example, CO2 narcosis. So again, this excess CO2 will interfere with the relay of that sensation. Even uremia. So when there is renal injury and increased urea and other toxins, again those toxins will interfere with the relay. And we can consider congestive cardiac failure. Congestive cardiac failure. Again here because of improper perfusion of the tissues, they will produce abnormal metabolites, which will interfere with the relay of joint sensation in the higher nervous system, which is leading to flapping tremors. So this is again a sign of liver cell failure. So these are some head to toe signs which you have to look for when we are dealing with a liver related cirrhosis case. So to sum up the findings, I will just mention the things from head to toe again. Icterus, parotid swelling in the head and neck. Then in the chest, we told that there will be loss of hair, gynecomastia, then breast atrophy, and spider nevi in the chest. Then comes ascites. In genitalia, there will be testicular atrophy. Then we will examine at the peripheries, extremities. There we can get palmar erythema. We discussed about Dupuytren's contracture. Then ecchymosis because of synthetic function of the liver abnormality. Then there will be pedal edema. Again, albumin synthesis defect. At the end, we discussed flapping tremors, astraxis, or negative myoclonus. So these are the things which we have to examine. Here we have stressed a few things that some findings are directly correlating with the alcohol intake. Among that, carotid swelling, then breast atrophy, then Dupuytren's contracture. So these are few things which directly tells us that the liver injury is secondary to alcohol intake, and few things are mainly because of hormonal imbalance, which we have already discussed. So I hope you understood all these signs with mechanisms and how to mention them from head to toe. Thank you so much. Please subscribe to our channel for more such academic videos. Thank you.